So I feel like dentistry has become like a commodity, like cars are like a phone or a piece of furniture. And I feel like patients are treating it like a piece of furniture, and they're looking for the best deal. I know as a dentist that dentistry is not a commodity, and not every dentist out there are equal by no means. And the quality of dentistry, as far as the expertise, the material used, and there's so many other factors that goes into dentistry, is not the same. And how did we get into this? Like how did we cause this thing to start, and then how do you think we can help educate the patients, and what are we doing here that you feel that's working, and what your experience in the past working in all these other types of settings that you don't feel like worked and could be borderline unethical or
Sure. So a lot of offices that I worked in the past, they seem to be really focused on getting people in the door, getting them to start something, and then kind of once you have that patient that started something, every 6 months, every year, maybe utilize their insurance. A lot of people get $1,000, $2,000 of insurance, utilize that, and then move on to the next thing. So one of the problems that I saw with that, people had a lot of other conditions, a lot of other stuff going on, and it just wasn't really addressed. And the big thing is when you have small stuff, it's a good idea to treat that while it's small, because the reality is no matter how good of a dentist you are, nothing is better than your natural tooth.
Right.
And you could shave away tooth, you could put a filling, you could trim the tooth, you could put a crown. Eventually, all that stuff is going to fail. And so when you get on your third or fourth failure on a tooth, now you're looking at, possible extraction, possible root canal, crown, and maybe an implant. So a lot of these places, they kind of try to market themselves as being cheap or, more affordable. They'll use whatever words they can. But the reality is over the lifetime of the patient, that patient's probably paying more than if they were to kind of get something more comprehensive, get everything looked at. And I think a lot of dentists are afraid of patients being overwhelmed and maybe telling them, no, I don't want to do that, or no, you're too aggressive, or my other dentist told me I didn't have this stuff. So it's interesting you asked me kind of what do we do here that's working. And I think the biggest thing that we do is if I tell you that there's something going on, I'm going to show you a picture. I'm going to show you an x-ray, and I'm going to explain the x-ray in an easy to understand way, but pretty much once I kind of tell you what I'm looking at, any patient can see what's going on. And I always ask patient, I'll see something on an x-ray, and as a dentist, I'll tell you it's a radiolucency on 13.
Right.
You know what I'm talking about. Patient doesn't.
Right.
But I could say, do you see that dark spot?
Right.
Okay. Everybody can see the dark spot.
Right.
And then you can also use the other x-rays to show progression. And then, we have a lot of before and afters.
Right.
We have different kind of informational sheets that will show progression of disease. So when we educate somebody and we tell them kind of, this is where you're at today, this is what could happen if we don't do anything, you now put the patient in the driver's seat. The patient can make the decision, and that's how you go to bed at night, sleep.
Right, sleeping. Yeah, that's a great point. When you talk about patients coming in with a lot of problems and just focusing on one tooth, we call that single tooth dentistry, and it's done in most offices. Yeah. And you're absolutely right. The problem that you mentioned that I think you were right on point is that if the patient has financial constraints, if a patient has an issue with the overall picture and the finances, and to avoid that, when you go to a dentist and they just take the worst one and deal just with that, essentially they're putting all the funds into one tooth, and ignoring everything else that's going on in the mouth, and allowing those smaller restorations that we talked about to get worse and turn into like the crowns and the root canals and the extraction. So it's essentially costing the patient much more in the long run. And the fact that we educate the patients about that here, and we sometimes give them the option of possibly even not working on that really bad tooth, but taking care of everything else.
Yeah.
So everything else doesn't get to that point. And patient may have to extract that one tooth, but that's one tooth that he's gonna lose. But versus putting all your coins and money in one area and letting everything else go
Right.
to get much worse. And another thing I wanted to talk about is in dentistry. You see all these marketings for like $300 implants and really like outrageous, like fees for stuff that as dentists who are, we are in the business and we know the cost of everything is, and we know that the cost for those procedures, the cost just for the material in those procedures is more than what they're offering. What do you think, what kind of problem is that creating for patients? And how is it affecting the perception of the field? Because I feel like it's completely misleading.
Sure.
And what is it doing to our image as dentists?
Well, I think when you see a sign that says implant $300, it's kind of like if you saw a sign that said car $300.
Right.
So a car is a car, but you want to know what you're getting.
Right.
You want to know exactly, where is this coming from is reliable. And so with implants, yeah, they are a little bit more costly than, a standard dental procedure, but there's a reason. There's training that the dentist needs to go through, the material cost. These, major implant brands, they have years of research, they have research and development teams that are always working on stuff, and there's surgery involved, skill of the clinician. Any dentist can go in and put an implant in, it's not against the law to do that, but when you're getting it done as a patient, you want somebody that's skilled, that's an expert at it. And so ultimately, when you look at the cost of, you might be able to go to office, get a filling for $50, something like that. You want to know what material is being used, and so here we like to use pretty much premium materials for all of our restorations. The best composite that we could get, zirconia crowns, porcelain crowns. The implant systems are great, and in other offices I worked in, we've used materials that we can put a filling in, it works, but 2-3 years later, we got to redo it, and it just kind of goes back to what I was talking about. You only get so many shots at the tooth to fix it until you're gonna either have sensitivity, you're gonna have a tooth fracture, or worst case scenario, an extraction. So I think the biggest problem is it's not just about the cost of getting something done on the tooth, but you're looking at the cost of how much time is put into the tooth, what materials are being put in the tooth, who's putting that into your tooth. And basically what you're paying for ultimately is longevity and an assurance that you're getting the best result that's possible for the procedure.
So, you hit everything right on point. Wrap it up.
Yeah.
So you pretty much put everything right on point, and I just wanted to point something else out, and I wanted to see what your thoughts are on that. When you see these special offers, from my experience, it's usually not what you get. It's like a bait and switch type of thing. It's like they bring you in for thinking that this is going to cost you $300. By the time you're out of the door, it's costing you over $2,000. And I just I feel like that's so misleading, and just putting these numbers out, it creates this perception in amongst average people, thinking that implants don't cost that much. These guys are just making a lot of money on them, and that's why the fees are so
Sure.
high. But if you ask anyone who's been through the process, they'll tell you, and we get a lot of patients coming through. It's usually by the time they add the bone grafts and this and that, and the crown, the abutments fees, and all these additional fees, then they have to add the upsells to bring the fee to a place where it makes sense, and it can be doable for them. And of course, like you said about operators' experience, quality of the material, and all that counts. Just wanted to shine some light that in most cases, if you see something that's just outrageously crazy, it's probably not true. And anything, I know this is a conversation that's we'll come back to, and there's a lot of other stuff I want to cover, but anything else you want to add for now, until we revisit this conversation, because I feel like this is such a hot subject, and that we can sit here and talk about it for hours and hours.
I would just say that if I was a patient going in and I saw something that seemed too good to be true, ask questions, ask about, and this just goes to anybody, even a patient coming here, ask questions, ask about potential complications, get educated on what's happening, because at the end of the day, you're coming to a dentist to be worked on, but you're going home with that product. So ultimately, being engaged, trying to learn as much as you can about your oral health. And, as a dentist, I love when patients ask me questions, because it shows that they're engaged, they know what's going on, and they can make better decisions. So that's kind of the main thing I would say is, when it comes to the finances and costs, obviously that's a factor, that's something you have to consider. But ultimately what you're looking at is where do you want your results, what are you looking for as your end product. And so the more you know about that, then you could kind of figure out all the other stuff.
Okay, great. So ultimately, I think the outcome is the price matters, but the cost matters more. So and the long-term cost is really what should matter more, at least. We'll have more conversation with Dr. Saran about Hollywood smiles, all the requests we get for all these makeovers, and all the unnecessary work that's done, all premature work, extensive procedures, and how we get patients coming back to redo and undo a lot of the mistakes. And I just had a really interesting case. We'll talk about it next time. It's been nice. Thank you again, Dr. Saran.